Shalom, everyone. Dr. Gabbay received his medical degree from McGill University in 1998 and graduated in 2002, specializing in internal medicine. His areas of interest include pain management, obesity, and metabolic syndromes, and preventative medicine. He started his career as an emergency room consultant and started shifting towards outpatient practice by 2009. Discovering an unmet need for pain management in the West Island, he developed an expertise in injection techniques for pain management and dealing with complex pain conditions. By 2012, he founded Clinique Médicale Mediplex in the West Island, specializing in pain management, obesity and diabetes, and preventative medicine. He was interested in finding novel ways to manage pain that do not include the pain of injections and have minimal to no side effects. He was intrigued by the power and healing effects of light. He studied the science and the use of lasers over a period of 4 years, and in 2020, he founded Oral Medical Laser, the first and only clinic in Quebec, specializing in the care of pain through the use of laser. Honored to have Dr. Moshe Gabbay talk to us about exploring the new frontiers in pain management. Go ahead, Moshe.
Hello, everyone. اليوم قلت بلكي أعطيكم كل أحكي وياكم بالعربي, but then I realized there's going to be some of us that are not going to understand in Arabic, so I'm going to give it to you in English, okay? In question period, I'd be more than open. If you guys want to ask the questions in English or Arabic or whatever other language, it's fine. So I'm going to start by telling you about a fun case that I had a few years ago that illustrates what I'm going to be telling you about afterwards with regard to pain management. Basically, this was a 32-year-old gentleman that I saw a few years ago. And he came to see me after having pain in his right shoulder for over 6 years and wanted to come for an opinion regarding how to manage it. This was a gentleman who wanted to work in deep sea diving for an oil rig, and not being able to use his right arm was a major problem and impediment for him. So in terms of his past history, this is where it becomes quite fascinating. So this guy was actually part of the elite commando unit for the army, and he served both in Iraq and Afghanistan. And he was telling me about the type of training that he got. And he basically told me that one of the things they taught them is how to operate on themselves on the field if they ever needed to, so that he can manage pain in, like under any circumstance. He was both in Iraq and Afghanistan, where he had several gunshot wounds. He was involved in a roadside bomb. He had 8 of his ribs fractured, as well as multiple other limbs. And despite that, he overcame all of these pains. But while in the army, he developed a pain in his right shoulder from an injury. And that was the one thing that eventually led him to being early retired from the army, because he was not able to perform his duties adequately because of this pain. Over the next 6 years, he needed to get several investigations, and he was seen by specialists. He had physiotherapy, occupational therapy, was seen by chiropractors, osteopaths, orthopedic surgeons. He had injections. Several different medications, nothing really worked. During that time, he actually worked as a bodyguard for a Saudi prince. And after serving for that young gentleman who was, not really, was absolutely careless in how he was conducting himself, he wanted a change in careers. And this is where he was coming, where he was hoping that I'm his last resort and would be able to help him out. So I proceed to examine his shoulder, and shortly afterwards, I tell him, "You're in luck. I have a feeling I can probably either make your pain a lot better, or I can actually completely alleviate your pain." So he was intrigued. And I told him what we're going to do is I'm going to give you several injections into the shoulder. Okay, and they're all going to be into the muscle. None of them involve cortisone. But because of the complexity of his shoulder pain, we're probably going to need several visits to manage this. So we did 4 injections, and I told him we're going to have a follow-up in a couple of months from now to continue with more injections. A week later, he calls us up and he says, I really need an appointment for additional injections. I felt some relief. I need more, okay? And I need it right away because I'm leaving on an assignment again in Saudi Arabia, and I'm leaving next week. Can you please have Dr. Gabbay, so he was speaking to my secretary, accommodate me for this week? So she spoke to me and I said, you know what? I really like this guy's story. I'm going to make an exception and I'll accommodate him for this week, okay? Found him a slot on that week. He comes to see me and he goes, Doc, I'm not leaving until you take away my pain. So that was a nice challenge. And I literally spent about an hour with him, and we did another about 15 injections during that time. Every injection, you have to understand, is extremely painful. And he was just toughing it out and wanted to keep on going until it was done. When I finished the last injection, I asked him to move his shoulder around and he has no pain. I said, okay, let's now do another test. I want you to try and do a push-up. So he goes, I haven't been able to do a push-up in 6 years. So he goes and he does 10 push-ups, and the guy was absolutely floored. So I didn't see him afterwards for about a year, and he came to see me for a different reason. And I asked him, what's up with the shoulder? He goes, Doc, it's gone. Okay, the pain never came back. He went to do his deep sea diving. He started exercising at very high intensity. And after that visit, I never saw him again. So the question is, what was it that was different about this approach that no one else in the past was able to do? And what were these things that were injected that were able to give him such a relief? Well, these are called trigger points. And basically what a trigger point is that it's a knot in the muscle. If any one of you have ever been to a massotherapist, one of the things that they would tell you when they start massaging you, they tell you, oh, you seem to have a lot of knots. So what are these knots? Each one of these knots is considered a trigger point. One of the things that you need to know about a trigger point is that our muscle is a nice fiber. It's like, like millions of fibers that are interlaced with each other, and they're nice and smooth. However, sometimes what happens is that those fibers get locked in and they stay stuck in a locked position. When they stay stuck in that locked position, it forms a knot. And that knot is basically a bundle of muscle fibers that is stuck with each other. And one of the things that happens when the muscles go into a knot is that the blood vessels in the vicinity also get compressed as the contraction occurs. Now there's a reduced blood supply that's occurring in an area that's in a knot, and the nerve that's associated with it starts to get irritated and becomes quite painful. And these knots can sometimes last for a short period of time, and sometimes it can last forever, and they never go away in some instances. So the issue is, why is it that such a small thing caused such a big dysfunction? And to understand that, I will give you an analogy. So if you ever, walked on a gravel road and you had a little rock or a little pebble go into your shoe, and it has a little bit of a sharp edge, you go and now you try to walk on that, and it's going to cause extreme pain in your foot. So what are you going to do? You're going to try to, move your foot around. Either you're going to walk on your heel or on the side of your foot, or you're going to limp. Anything to try and avoid the pressure on that pebble. So what's a better option? Walking around and kind of altering your gait, or removing the pebble. So the best option is actually removing the pebble. When I treated this gentleman, what I was doing with, when I was doing the injections is that I was removing every single one of those knots. And, each one of these trigger points was getting released. And this is why it allowed the muscle to go back to normal function, and he was able to conduct his activity afterward. So these trigger points, even though small, they cause an entire dysfunction of the muscle that they are associated with. So one of the things that I want you to understand is, what is the mechanism of pain? How is it that you can have a pain starting from one single region, and why it can start from a dot and then become a wider area of involvement? So one of the things is that every single muscle fiber that we have in our body has a nerve that's associated with it. Each one of those nerves then leads up to the spine. And then in the spine, there's a processing center. That processing center will try to assess the intensity of pain and decide what is the importance of that pain, and decide whether that pain can be alleviated, and then it just sends chemicals to completely take away the pain, or whether this is a pain that requires more attention. When it requires more attention, it's going to actually relay the information to your brain and tell you there's a damage somewhere. Not only that, the spine also then works to amplify the pain. And the amplification occurs by stimulating other nerves in the area, which is how the pain starts from a single spot and it starts to spread. Then your brain interprets that pain, and it has to decide, what to do about it. Okay, so now you may have a mechanism where you're going to try to protect the injured area. You may alter your activity. You may try to rest, or seek some help, or do something else as a consequence. Another thing that the brain does is that it actually adds an emotional component to the pain. So now, oh my God, what does this mean? Did I break something? Is this going to go away? Am I going to stay stuck with this? And you start becoming worried about it. And the more you think about it, the more the pain will start to intensify. And this is where the emotional component is. Okay, now, for the emotional component to understand its importance when it comes to pain interpretation, I'll give you another analogy. And this is perfect for Iraqi young mothers, okay? So I start off by describing an 8-year-old child, okay? So your son or daughter is running around in the courtyard playing, with their friends, or playing soccer, and your child happens to go and fall down, scrape their knee, and they're bleeding from the knee. Now you happen to be on your cell phone, you didn't pay attention. The kid falls on the ground, sees their friends, nobody's paying attention to him, sees his friends are continuing to play. He gets up, looks at his wound, jumps up, and goes back to play. In the other instance, the mother is looking at the child, and she goes, "We abish." She looks at this situation, and she runs to the kid. Okay, and she looks at it and she's like, "We are mad. Oh my God, this is awful." The kid looks at the mother and starts to cry, and starts to feel the pain, and starts to feel it stinging, and starts to limp, and is unable to get back into the game. And now the mother takes him and has to clean it up and so on. So here we have a situation where it's the exact same kid in two different scenarios and the exact same injury. In one of them, the pain suddenly disappeared. And in the other one, the pain intensified and it lasted longer. And this is where the emotional component to pain comes into play. And this is how the brain will tend to amplify pain. Now, another one of the things that you need to understand is that whenever people have pain, there's an issue with stress. Okay, so whenever people feel stressed, it causes muscular tension. So if you have any area in your body that is painful and you add stress on top of it, that area will become more painful, which is why people who are stressed will generally feel some tension in their neck or may feel tension in their lower back. It's really related to the stress. Now, if you develop a pain that lasts for a prolonged period of time, there's other emotional components that will also amplify it. So people will start getting frustrated. They will feel angry. They may feel some fear as to what this means and how long it's going to last. Every single negative emotion that you will have will serve to also amplify the pain. So the issue is when you have, like the pain now has the potential to become more chronic as time goes along. And one of the things that happens is that the moment the brain sees the area as painful, and now you add an emotional component and you've amplified the pain, it actually starts to occupy a bigger portion in your brain. So every part of our body has a map in our brain. But the moment that pain level goes up, that area starts to expand. And as the brain mapping for pain starts to expand, well, the same mapping then that corresponds to areas in your body that are going to have the pain. So now the pain starts to spread and you're going to start feeling it in other parts of your body. And it tends to grow and expand as a consequence, leading to further dysfunction. So looking at all this, we can see how, starting from a little pebble, how it can progress and really build up to a much more significant thing. So the most important question is, how can we prevent the pain from forming in the first place? So the first thing that we need to realize is the importance of our musculoskeletal system. So we have our muscles that cover the entire body, and they have a very important function. So they are there for our locomotion, for our movements, our ability to pick up things, for our posture, our ability to stand, our ability to get up. It provides support to our joints, and it also provides support to our spine. One of the things that I explain to people, like in terms of understanding, how the muscles work, and especially when it comes to posture, because the areas that people will experience the most pain in, or the most frequent areas of pain, are typically the neck or the lower back, and they are all attached to the spine. So the question that I have to people is, if I strip the body from all the muscles and I just leave the skeleton, would the skeleton be able to stay upright, or would it collapse? The answer always is it's going to collapse. And a perfect example, if people remember the late Stephen Hawking, the physicist, okay, who sat in his wheelchair, he always had like a crouched look like this. He could never sit up, and that's because he had no muscles that offered him the support he required, to be in an upright position. So we absolutely need the muscle for all of these things. The problem is, after the age of 30, we tend to lose about 1% of our muscle mass per year. So not doing anything, our body is just gradually losing that muscle mass. For some people, it's more accelerated than others, depending on their activity level. So people who generally are more sedentary will have their muscle loss that may occur at a faster rate than people that are more active. But even if people are active, they will still have some muscle loss that is going to occur, but at a much slower rate. So one of the things that we were talking about is this whole concept of posture. So the spine, in order for it to stay in an upright position, you need all the muscles to support it. But if you're gradually losing 1% of your muscles, then what's happening is that support of the spine starts to go down. And over time, as people get older, they start to shrink. And the reason why you shrink is that gravity is always pulling down on you. And as the muscles are going down in strength, you have less support of the spine. So now the spine has to take a bigger load and you start to literally compress. So your neck will get smaller, your spine's going to get smaller, and you're going to start losing height. The problem with that is that wherever the muscles were tethering on the spine, now because you've changed your anatomy, they're no longer attaching in the same way. Now, because you also have less muscle, any kind of activity that you're going to do has to be done with less muscle fibers to do the activity. So now you're much more prone to having injury. And once you get injury, it also takes a lot longer to recover. So now that you understand the importance of the muscle, the question is, what can we do to preserve it so that we never have the pain in the first place? Well, the first thing is doing targeted type of exercise. So you need to do certain exercises for different muscle groups throughout the body in order to preserve the muscle mass and the strength. The next thing is proper nutrition. The average amount of protein that is required to be consumed in order to just maintain your muscle is on average 0.8 grams per lean body mass. So the question is, what is lean body mass? So a person who weighs 200 pounds, doesn't need protein for 200 pounds. They need to establish what is their lean body mass. And the simplest way is if you actually see what is for your height, what is your ideal weight, if you calculate a BMI or body mass index of 23. So if you go online and you write BMI 23, you plug in your height and you see what weight would correspond to that. And then whatever weight you have, you do 0.8 grams of protein for that weight. That's the amount of protein you should be consuming every day, just so that you're not going to be losing muscle related to loss of protein. So now that this is how we can preserve our muscle. Now, in the event you do develop a pain, the most important thing in order for the pain not to become chronic is to address it immediately and aggressively. It has to be dealt with either with medications, with physiotherapy, massotherapy. You do the kind of imaging or have it evaluated as quickly as possible. You want to break that pain within under 2 weeks. The moment you go beyond 2 weeks of pain, you are now entering a zone of what is called subacute pain. And the moment you pass 3 months, you are now into chronic pain. And your chances of being able to break chronic pain become much more difficult. So the first thing that you need to do when you develop a pain is to see if there's something that you can do to alleviate it immediately by identifying whether you have a trigger point. So let's say you develop a pain in the neck or you develop a pain in the back. How do we identify if we have a trigger point? So what you do is, rather than trying to rub the entire area with your palm, you go with your thumb and you try to look around and you're looking for very specific spots. So the trigger point is typically the size of your tip of your thumb. And you just go and you palpate around and you try to find a spot that will, reproduce your pain. Once you find it, what you do is you massage it, like regularly, and then what you try to move your limb while you find that spot to try and completely break that knot. And it's very important to do it as soon as it forms, and you're going to feel relief almost immediately after. And this is how massotherapy helps, but you can do it to yourself by identifying it. Now, if it is in an area such as the back or your shoulder where it's not accessible with the finger, I recommend using a tennis ball, putting it against the wall, and then you put your body part that hurts right against it, and you try to alleviate that knot with it, just rubbing hard against it. The sooner you break it, the faster the relief. Now, if you do develop pain, the question is, what's the role of imaging? So let's say X-ray or MRI. How useful are these things? Well, it depends on what the cause of the pain is. So if you actually ripped a tendon or you broke a bone, then imaging is definitely going to be helpful because we need to decide if we need to do any kind of surgical intervention. But if you have a chronic type pain, then chances are that either the X-ray or the MRI are not going to be helpful. Why? Because we're going to find a lot of what are called degenerative changes that are extremely common in everybody. So if you're doing any X-rays of the neck or your back, we're going to use terms like degenerative disc disease, or we're going to use terms like osteophytes, or facet arthropathy. Those are all terms that all mean the same thing. It's just degenerative parts of different structures within the spine. So the majority of people will have no pain, and if I image them, I'm going to find these things. And then people who do have pain, we're going to image them, and they have these things. So the question is, how can you tell from an image who has pain and who doesn't? And the answer is, you can't. And therefore, these imaging modalities are not very useful. Now, the other thing that I want you to know is that in the event, let's say that you have a muscle pain and you're looking for that trigger point. Other things, we talked about our physiotherapy, and then, you may want to use either heat or cold for additional relief. If it's a joint, then, you also want to use analgesics to give you some relief. And the next thing that you may do is that you may actually go for an injection. And if you go see an orthopedic surgeon for a joint, you might get a cortisone injection. Now, are there any issues with cortisone? The answer is yes. So whenever you hear cortisone, you have to kind of be a little bit weary of it. So the issue with cortisone is that it's an extremely effective treatment for pain. 85% of people who are going to get a cortisone injection are going to get relief. So it's not everyone. The average time that you're going to get relief for is about 3 months. So 85%, 3 months if you're lucky. But after 3 months, what happens? For the majority of the people, the pain comes back. So what's the downside of cortisone? Every single time that you take cortisone, it's not only that it alleviates the pain, it actually thins the structures that it's in contact with. It inhibits the buildup of the bone. It inhibits the cartilage. It inhibits the ligaments and the tendons, which basically what happens is that it actually ends up thinning all of these structures. And then that particular area that just got the injection becomes more susceptible to injury down the road. So you're getting an immediate relief, but you're actually potentially harming yourself for the future. So cortisone, when people come to me and they need cortisone, I tell them it's a one-shot deal with me. And, if your pain is gone with that one shot, great. If it comes back, we have to look at other options. You're not getting another shot of cortisone in the same area. Okay. Now, so one of the things that we need to know is we were talking about injections that are painful, cortisone that is potentially harmful, maybe surgical techniques that have their own harms. The question is, now we're in the 21st century. Is there any modality out there that can be delivered to help heal an area, accelerate the healing, remove the inflammation and the pain relatively quickly, and the administration of the procedure is non-painful? Well, this is, now that we're in the 21st century, the answer is yes. And the best treatment for any kind of pain condition is actually using light therapy. And for light therapy, if any of you have heard of them, okay, so it goes by different terms. So it goes by low-level laser therapy or photobiomodulation or cold laser. Those are all different terms for the exact same modality. So you can basically use either light in the form of LEDs or in the form of laser. The question is, what's the difference? So when you're looking at LEDs, and everyone knows how LEDs work, they basically spread the light around, and they're extremely weak as light sources. They actually can work extremely well for superficial type of pain. Lasers are required when you need a deeper penetration of light to get to deeper muscles or to joints. So the question is, what do these things do? So when we're talking about light therapy, the vast majority of the time, we are talking about light that has the ability to penetrate the skin. So the skin, our top layer of the skin, is actually almost impenetrable to light. So there are wavelengths that we need that will be able to go through that skin layer. The two most common wavelengths that we use are called red light or near infrared light. So infrared is a light that we do not see, and infrared is actually the type of light we get from the sun that gives us a sense of heat. Okay, so both of these light have the ability to penetrate deep into the tissues, which is why those are the main lights that we use. So we use either red light, infrared light, or we use a combination of both. So the question is, what happens when you're shining the light into an area? So we have in our body, we have like little molecules that provide energy for the cells. They're called mitochondria. And when there's an injury, the cell doesn't work very well, and the mitochondria actually becomes depleted of energy. And it doesn't deliver the energy to the cell, so the cell becomes completely depleted. One of the things that's important is to try and energize the mitochondria. It has different chemicals in them, like including copper, that actually soaks up both red and infrared light. So when you're delivering the light to it, it turns on the energy of the cell. So the cell starts to actually become energized, and it starts its own healing process all over again. The other thing that happens is that the light is also releasing chemicals into the blood vessels that causes the blood vessels to open up and dilate. So now you have the cell that's healing itself and the blood vessels around it that will start improving the circulation. If there's inflammation in the area, it downregulates it, and the nerves that are hyperactive and sending the pain signals, they're going to be calmed down. So by delivering the light, you're actually accomplishing all of the things that are necessary to accelerate the healing of the wound. You're reducing the inflammation. You're energizing the area that is defective. You're actually stimulating also stem cells, which are basically the cells that are responsible to produce new cells to heal an injured area. You're improving the blood flow and basically calming down the nerves. So you're accomplishing all of that with the delivery of light. One of the things that I tell people with laser is that I don't know what's happening on the inside. Okay, so the same thing when you cut yourself, okay, and you look at your wound, and it, your body just kind of does its thing and it heals it on its own. And I tell people, okay, so you tell me, what are the steps that are required to have this heal? Okay, when do you have the platelets come in? When do you have the, like all the other components, come in, and in what order? A human being is not able to reproduce it. And it's the same thing when it comes to light. I don't know what are the steps that are necessary to heal the area. But by delivering the energy into an injured area, your body, all the injured parts know exactly what to do. And so the moment you deliver the energy, the body on its own takes it up, and all the parts that need it will start healing themselves. And you absolutely accelerate the healing. Now, this is not a new technology. It has been around for over 40 years. It's just that our state of science to understand the principles for how it works has only been available in the last 10 to 15 years, which is why it's not yet a common modality amongst people, okay? So now you may be amongst the first people who are learning about the importance of this incredible technology. Now, in conclusion, okay, actually before we talk about the conclusion, so the question is, what injuries can be managed with this, okay? So bone fractures that actually fail to heal, when you shine this light at them, you can cause the bone to heal. Any superficial wounds or deep wounds, it's going to accelerate the healing. People who are post-operative, if they have any cuts, it's going to accelerate the healing. If you have any muscle injury, bone injury, joint, ligament, tendon, all of these things can have the ability to respond to the light therapy. So in conclusion, I gave you an example of a gentleman that I treated that was absolutely fascinating. And he was treated with a lot of needle injections. The majority of people are actually very reluctant to have the needle injections because they are extremely painful. Now, we have a new modality in the 21st century that we are actually able to achieve the same thing without pain and in a much shorter course of time. But more importantly for you is how to take care of your muscle, that you are never going to be in that predicament in the first place. And you need to make sure that you do the proper physical activity and you do the proper nutrition for it. And then I may not need to see you for a pain condition in the future. Any questions? I'm more than happy to answer.
You can raise your hand. You can write your question in the chat, or you can put the reaction button at the bottom. Normus Hayek has a question. Does it work for nerve injuries?
So it depends what type of nerve injury. People who have a peripheral neuropathy, so basically where the nerve endings are, frayed at the surface. So people who have diabetes or people who have other types of neuropathies, the answer is yes, it works for that. Sciatica can also respond to it. People who have what is called the post-herpetic neuralgia may respond to it. I can tell you that I've done 2 patients actually with post-herpetic neuralgia on the scalp for a long time. It did not work on them. So it doesn't work for all neuropathies, but people with peripheral neuropathies, I've had very good results. So it depends on what type of nerve pain it is. And since there's a big variety, it may not have, be good for everything.
The next question is from Dorothy Lapstone. Is sunlight a type of light therapy?
So sunlight is the absolute best light, okay? Because sunlight is, you're getting all the rays, okay? But you're getting the ultraviolet, the infrared, you're getting, like the whole visible spectrum, and you're getting absolutely everything. So the issue is that you're getting the whole thing, but they're all coming to you at the same time. So you're getting a little bit of each one, but because there's so many of them, it ends up being a lot. And it may not be enough of the beneficial rays that are going to be penetrating deep enough in the tissue. And for you to get enough of a relief, your skin is actually going to burn. So sunlight on its own is generally, it feels good for a person who doesn't have pain, but for management of pain, it's generally not good enough.
Thank you. Jennifer Michelle has a question, and it actually covers Albert Herskovich. When you mention injection, are you injecting a substance, or is the needle reaching the trigger point similar to acupuncture? Okay,
so in terms of the depth of the needle, so typically when you're dealing with acupuncture, the acupuncture needles typically stay within the dermis, which is, it will go probably about 3 millimeters deep. When I'm doing injections, I am actually going all the way to the muscle, and depending on how much fat there is on top, sometimes I actually need to go as deep as 2 inches inside the person's body. And yes, I am reaching the trigger point with the needle. And it's a mechanical disruption that causes the pain. So what happens is that as the needle touches the knot, there's an immediate reaction where it stretches and releases, and this is what causes the pain. So it's not the needle itself that is painful, it's actually the mechanical disruption that is painful. And yes, I am going all the way to that area. Once I reach it, I inject lidocaine, which is just a freezing agent, so that the area doesn't go back into spasm. It calms it down and then it heals the area. I can't hear you.
Cheryl Gabbay, can you unmute yourself?
Yes. Okay.
Hi.
Well, hi. Thank you so much for the talk. It's really, really interesting.
A pleasure.
I have a question about, you mentioned like the psychological, emotional, social component of pain and chronic pain.
Yeah.
And I'm wondering from your experience, how much with your patients have they benefited from mindfulness or psychotherapies in their treatment, especially maybe with regards to patients you have that might have experienced traumas and things like that? I'm just wondering.
So the issue is that it really depends on the type of pain condition that they have. Okay, so not all pain. So if you're coming in, so if like that case that I gave you, for instance, like the guy with the shoulder, okay, mindfulness would not work at all for him. He has a mechanical disruption,
Okay.
but there wasn't a psychological. It really was causing a true dysfunction. Okay. But people who have underlying depression or post-traumatic stress, or who have had child abuse or other traumas or ongoing stressors, there's absolutely a psychological component. It's something actually that we call catastrophizing, where the pain is just causing an absolute debility. They're completely disabled by it. These are people that will absolutely benefit from mindfulness-based, like therapy, where they need to start learning how to manage their emotions. There's also what's called biofeedback, where they're gonna, like where they can wear some monitors to kind of see the, like their heart rate, or like their muscular tension go up whenever they're starting to feel like they're getting more stressed, so that they learn how to relax themselves. So not all pain treatments require it, but there are quite a few that will absolutely benefit from it.
Okay. Thank you for your answer.
You're welcome.
Dina has two questions. What about fibromyalgia, and what about polymyalgia rheumatic?
Okay, so all right, we're going into very specifics. Okay, so first of all, polymyalgia rheumatica does not fall into any category that I've mentioned. Polymyalgia rheumatica is an autoimmune disease where it's your immune system that's triggering an inflammatory condition in your body. For that, you absolutely need to be treated with prednisone. It is the only treatment that's recognized for it. Okay, and it's oral prednisone. No injection will help for that. Okay, in fact, polymyalgia rheumatica, it's the most amazing diagnosis, where if a person has it, you give them about 15 milligrams of prednisone and the pain disappears by the next day. Fibromyalgia is a different kettle of fish. Fibromyalgia is actually the bane of existence of any physician, because nobody knows what to do in fibromyalgia. Fibromyalgia, as I mentioned, with chronic pain, one of the things that happens is that you can start in one area and then it starts to spread. Fibromyalgia is like a metastatic cancer. It's basically the pain has spread over the entire body, and it absolutely, like this causes complete dysfunction of the person, and it causes dysfunction of the mind as well. So people will have fatigue, something called fibrofog, where the brain doesn't function well and they have just a generalized pain. This is not amenable to injections, and the treatments for it are absolutely awful. They do not work, or they work very partially, or they get like a lot of side effects. So sorry, but I do not have the magic formula for fibromyalgia yet.
Thank you.
Okay.
Michelle Sharabani is asking if it works for arthritis.
What type of arthritis? Are we talking osteoarthritis or inflammatory arthritis? Are we talking about laser, or are we talking about, it depends on what we're talking about. So, okay, so let's assume we're talking osteoarthritis, which is the most common degenerative arthritis and typically affects the hip or the knees and so on. And the answer is it does work. However, it's a mechanical disruption, okay, which basically means if you're bone on bone, the laser is not going to suddenly increase the space between the bones. So it's going to alleviate the pain for a short period of time, and then you're still bone on bone. The pain is going to just come back, at a later time. But a person who has mild osteoarthritis, they can actually respond quite well to the treatment. And if we're talking inflammatory arthritis, like rheumatoid arthritis or other type of arthritis, then yes, that absolutely responds to laser actually quite effectively.
Thank you. Here's a two-part question from Jacques. Is there an application of your light therapy to treat or remove gallstones, dissolve it? And has your light therapy is it useful for abdomen IBS condition?
Okay, so these are good questions. So first of all, gallstones are not destroyed by lasers, because the laser, don't forget, has to go through the skin into the abdomen, into a gallstone. So the amount of power that you're going to need to get there, you're going to have to burn through the skin before you get there. So there is a treatment where we can blast stones, and it's a shockwave therapy. It's called lithotripsy. It's with shockwaves. It's a very powerful and painful treatment, but it does not involve light. With regard to the other question that we were talking about with regard to IBS, again, it all depends on how deep the light is going to penetrate. It will provide relief, but IBS is a chronic condition that is basically generally related to food intolerances and dysfunction of the gut bacteria. The light does not alter that. So you actually need to go through dietary modification to change that around. I actually have incredible success rate treating IBS with dietary interventions, but light therapy will not work for that.
Thank you. What about abdominal scar tissue from surgery or any type of scar?
So if you treat the injury, the scar, immediately after you had a surgery, so let's say within a few days of having surgery, you initiate treatment, then it's actually going to accelerate the healing, the wound healing, in probably about a third of the time. And the other advantage is that it's actually going to probably not even leave you a scar. So it's the most incredible technology out there for alleviating wounds in a fraction of the time without the scarring. Once you form the scar, it will not do anything because now it's fibrous tissue and it's not going to destroy that. So if you want to remove a scar that has already formed, that requires what is called an ablative laser. So this, I do not do these things. This is not for pain treatment. This you need to see a dermatologist or a plastic surgeon, and it's a cutting laser. So it's a very painful laser where you're actually shaving the skin off. This is not what this therapy is about. This is one that does not generate heat and does not cause pain and does not injure any part of the body.
Thank you. This is a question from Dan. For type 1 diabetic, having cortisones have caused me to lose sugar control that can last up to 3 months. Are there other alternatives for severe back pain?
Cortisone for back pain? Okay, so first of all, there's no rule for cortisone for back pain. Okay, unless you have an autoimmune condition, there's absolutely no role for cortisone for back pain. Typically, you would go on anti-inflammatory medications, other type of analgesics, but cortisone certainly has no role.
Thank you so much, Dr. Moshe Gabbay, for an excellent evening full of information. We all have pain somewhere. Hopefully you've all absorbed something and you know what you're going to do next, call Dr. Moshe Gabbay. And we're going to invite everyone to unmute yourselves so you can all congratulate him. I'm looking for the button. Okay, you can all unmute yourselves.
Maximum for this one.
כל הכבוד.
Hi. Hi, Dan.
Very much. Thank you.
Thank you.
See what happens.
תודה, thank you.
כל הכבוד. מעניין.
כל הכבוד, משה.
תודה רבה, תודה.
That was very good.
Very, very good.
Very much. Yes.
Thank
Moshe,
you.
we came a little bit late, but it was great.
Thank
כל
you.
הכבוד.
תודה רבה, תודה.
I mean, look, it was $400. We spent $70,000 on this.
Thank you so much. And
Okay, thank you.
قباي
everyone.
انت تحكي عربي انت منين
Of course.
مولود؟
أنا وين مولود؟ أنا مولود
من
بإسرائيل.
مولود انت؟
ها؟
وين تعيش؟
أنا وين أعيش؟ أنا أعيش بالويست آيلاند هسه.
Where is that؟
دولار دي زورمو، تعرفوا الدولار دي زورمو؟
مونتريال.
اشكر
مونتريال.
او مونتريال. اشكر وجع بالعربي اشكر بين بالعربي اشكر
وجع تعرف وجع؟
وجع
وجع.
Let the other people come on yet, and just anything that
Thank you, Moshe. It was amazing.
Thank you, everyone.
It's great to see you also. It's been
Great seeing everyone.
Amazing.
Bye.
Thank you so much.
Now we just have to hope we don't get stopped by the cops because we're over curfew now. So, all right.
Thank you so much.
You're a doctor. You're a doctor.
Yeah. Bye, guys. Thank
Bye.
you.
Thank you so much.
All right. Thank you, everyone.
Thank you.
Bye.
Everyone, don't forget, every Tuesday night, we have Super Tuesday. If you enjoyed this evening, please make a donation in honor of Dr. Moshe Gabbay at the Spanish and Portuguese. Call Linda Abudi, send an email, do it however you want. And next week, we have Hagit Halprin.
Thank you. Thank you, Grace.
Thank you.
Also.
Hear you.
Yes.
כל הכבוד.
Thank you, Grace.
thank
כל
you,
הכבוד.
Dr. Moshe. Thank you,
Bravo.
Grace.
Dr. Moshe. Thank you.
Thank
It was a wonderful evening. We're all pain-free now. We got rid of all our pain.
Not quite. Now, who's going to help me?
Okay.
عندي وجع الشولدر مالي والرينج اوف موشن ما منيحة.